The third lesson is that change does not come from the halls of Congress alone. Laws are essential, but insufficient to make true change. It's people with a cause who make change. So I want us to consider a more recent case of a health movement, the case of breast cancer. In 2006, 73% of eligible women in the United States were screened for breast cancer. The average for the developed world was 62%, so we're ahead. Why? Because there's a movement with a clear vision and a goal. Hundreds of thousands of women, men, and children walk for the cure. We talk about it, we support it, we fund it, and that's had a huge impact. What this says is that when you create a movement around a vision, when you will no longer tolerate the status quo, we can move the needle. We aren't just researching new ways of treating breast cancer, we've also embraced inequities. We are now ensuring that both poor and well-to-do women have access to mammography. We agitated to have legislation passed that made it mandatory that both mammography and the treatment for breast cancer are covered for all women, including a special amendment in the Affordable Care Act. And we aren't stopping there. We want not only screening, treatment, and a cure, we want to understand how to prevent it. And the movement will not be satisfied until that happens. And I believe that we're going to get there. We are going to see that day. So this is what a movement can accomplish. This is what people with a cause can accomplish. We can do the same for health. And this leads me to the fourth lesson. It's critical that we move beyond the individual and that we embrace the society. Embrace the notion that change must occur at the societal level. What do we want our country's health to look like in the next 30 years? And how do we get there? I would say that we need to build the bridge from the approach that still embraces the individual to the approach that embraces the collective health of society in all of its complexity. So let's go to lesson 5, the need for innovation. In his State of the Union address 2 weeks ago, President Obama told us that our country must innovate, and it must innovate to make America first in technology and education. And I want to suggest that we have to innovate to create health as well. It is our most important product. One innovation I'd like to propose is bringing us back to that metaphor of building the bridge between healthcare delivery and public health. Healthcare, which takes an individual approach, and public health that focuses on populations. Today, these worlds exist in separate silos. It's the intersection between healthcare and public health where there is true power for innovation to advance health. It's a bridge that needs to be built. History and the civil rights movement can provide us with examples of how we might build that bridge. So I want to go back again to 1964 when Dr. Poussaint, along with Jack Geiger and Count Gibson, the founders of the Community Health Center movement, opened the second community health center in Mount Bayou, Mississippi. The first, many of you know, was right here in Columbia Point. Interestingly, the Community Health Center movement was funded under the Office of Economic Opportunity as a local community action program, not as a healthcare program. The model was an innovation that would bridge and integrate public health and healthcare, and would provide care that addressed medical issues within the context of the community. It would embrace economic opportunity as a way to advance the health of communities, and the model would advance a new model of shared leadership between the medical profession and the community. This new model used health as an organizing principle, building bridges between healthcare and public health, and so much more. New methods were experimented with. For example, the pharmacy prescribed food as a prescription for malnutrition. This was revolutionary in the 1960s. Today we have WIC, women, infants, and children. We have the food pantry at Boston Medical Center. But here is where it started. So fast forward to 2011. There are leaders working to bridge the gap. Here in Boston, our mayor and the Boston Public Health Commission have recognized approaches to primary care that demonstrate this connection, the necessary bridge between healthcare delivery and public health. And this is in service to improving the health of the city of Boston. One of the organizations that has been recognized was the CAVU Foundation. And this foundation has funded several pilot projects to prevent and treat childhood obesity in some of the underserved communities in Boston, like Roxbury, right in our backyard. They bring kids into community health centers, and they work with them in teams to learn strategies on how to either maintain or to achieve a healthy weight. They work in understanding their ability to access healthy food and exercise. They work with the families to give vouchers so that they can actually get healthy fruits and vegetables, healthy food at farmers markets. But they also work collectively with the farmers markets to improve access to healthy food, healthy and affordable food. The idea is to not only empower the individual, but to also address the individual as a product of his or her environment, and to also work to make that environment healthier and safer. They understand the devastating numbers of an estimated over 20,000 deaths in Massachusetts and 1,400 in Boston in the year of 2006 that are attributed to a lack of access to healthy, affordable food. And this becomes part of the mission of a shared undertaking between health, public health, healthcare, the food industry, and city and state government. This work is not a side activity. It is part of their job. It is what leads to health. This is the bridge, innovating to build the bridge to health. Another example of innovation focused on building the bridge is an approach to childhood asthma in the city of Boston. Massachusetts has the highest childhood asthma rates in the country and the second highest adult asthma rates in the U.S. The Boston Public Health Commission, again, understanding the public health implications of these numbers, created the Breathe Easy at Home program. And this program works to redefine asthma management to not only treat it, but to prevent it. The program brings to the fingertips of the physician the ability to order an inspection of the home for asthma triggers. The inspection, which is the public health tool, is ordered through the electronic medical record, the physician tool, and the data are collected, and they also provide critical information about asthma triggers at the community level. And this allows for community-based intervention, and it also leads to citywide action. You can picture that information from the doctor's office all the way promoting citywide action. It brings together public health and healthcare organizations around the city, and it brings them together into an integrated system characterized by an explicitly stated common goal with interdependence and information sharing. This is something that almost never happens amongst these systems. But programs such as this one demonstrate it can be done. This is the bridge, built through innovation at the intersection of healthcare, public health, and more. So, how ironic it is that today we have the ability through GPS to figure out where your car is. We can find you through your cell phone wherever you are in the world. Yet we still don't know very much about our patients' communities when he or she walks through our doors. Think about it. When you check into the doctor's office, to a hospital, you give your name, you give them your address, and it doesn't mean a whole lot. You're asked to wait. You might fill out a brief individual health history, and this is where it ends. We have the tools to do better, to make the connection between the individual and the community, between the individual and society, between healthcare delivery and public health. It's up to us, the innovators, to create the bridge. Another innovation in the civil rights movement was the use of the media. Dr. Poussaint witnessed the power of harnessing the media to galvanize people. He and others in the civil rights movement recognized that the media was a major tool for change. It was Dr. Poussaint who understood and who leveraged the power of imagery, the power of language, a power that influences all children. He went on to create the Media Center, and the center has studied the negative impacts of media on child development and child health, as well as working to better understand how media can be used to shape positive images. Remember The Cosby Show? Still my 10-year-old's favorite after 30 years. Dr. Poussaint is a visionary. He created a new field in medicine built at the intersection of child psychiatry, public health, and the media. Once again, the bridge. How can we innovate and use media in creating our bridge to health? So just as the great people of Selma took to the bridge from Selma to Montgomery, just as the civil rights movement was the bridge to equality and to the Great Society, current healthcare reform should be our bridge to health. The Affordable Care Act of 2009, while far from perfect, it did exclude abortion and it did exclude undocumented immigrants. While far from perfect, it does provide us with a framework, a means to an end. The law includes the mandate to ensure that all of those eligible will be insured, the mandate that preventative services in the doctor's offices will be offered without cost sharing, the dismantling of age and gender rating and exclusions due to pre-existing conditions in the insurance industry, the expansion of Medicaid and allocation of funds for innovative demonstrations that might lead to decreases in medical costs, the very significant investment in community health centers, the incentives for nurses and physicians to enter primary care, and most remarkably, an infusion of funds for public health, organizing the work done in government agencies under the umbrella of the National Prevention, Health Promotion, and Public Health Council. These are critical tools, a framework, a means to an end, a very important end, health. So in closing, I believe that the lessons from the civil rights movement that I've outlined today really give us insight into how we might vision, organize, and advance a movement for health. What can we do? How can each of us make a difference? The first thing we can do is take a page from Dr. Alvin Poussaint's journey through one movement, civil rights, to another, health. He has inspired us to recognize that health is the unfinished work of the civil rights movement. We can be inspired by the energy and creativity that he has embodied to make the difference. Dr. Poussaint, the way that we can honor your legacy, past and future, is to learn the lessons of the civil rights movement and to apply them to the movement today, the movement for health. We can walk across that bridge together and ignite a movement to achieve optimal health for all of society. I know we can. Thank you very much.